The White House COVID response team urged Americans not to let their guard down as they announced plans to step up efforts to track new variants of the virus.
But they also acknowledged the vaccines are not coming out as quickly as Americans would like, though there is progress in vaccinating the most vulnerable. Dr. Frank Me. George here with some highlights from today's briefing. Doc?
Yeah, Kim and Devin. So there's a pretty clear tug of war going on, with more states moving to loosen restrictions and the federal government struggling to maintain improvements in case counts and get more people vaccinated. And even with ongoing efforts to increase vaccine production, the demand far outweighs the supply.
The long-term care program has administered now over 4.8 million doses to more than 3.7 million of our most vulnerable. Those who were dying in large numbers over the last year are now on a path to protection.
White House advisor Andy Slavitt says of the over 40 million doses administered so far, over 17 million have been to people 65 or older. He applauded Americans patiently waiting their turn.
Our ability to vaccinate millions of the elderly, seniors, and healthcare workers is a testament to a society that has put our parents and grandparents, those who have served us, and those who continue to sacrifice for us on the front lines of the healthcare system first.
Scientific models predict the more contagious UK variant will become the dominant virus in the US by the end of March.
The encouraging news is that the vaccines that we're currently distributing right now are quite effective against that particular variant.
The US is behind on tracking variants. There's a new push to change that.
We anticipate that we're probably going to be sequencing up to 3 or 4-fold more than we're already sequencing. And I think once we have more sequencing that's happening, we'll have a better idea as to how many variants there are and what proportion are out there.
Now, the CDC director continued to stress that this is not the time to travel. When she was asked about the possibility of requiring a negative COVID test for domestic travel, she said it would be another measure to try and decrease spread. But first and foremost, she would simply encourage people not to travel if it wasn't necessary.
Noteworthy here, Frank, the school reopening guidelines. We were expecting to get those from the CDC. Not yet.
Well, we're now hearing that those could be released as soon as Wednesday. Those are supposed to lay out the minimum requirements for safely reopening schools. Obviously, there's a lot of disagreement, though, about whether various plans are sufficient and whether teachers should be vaccinated first. The CDC director actually sidestepped additional questions about those guidelines today, frankly opting to wait until they are officially released.
Let's see if that is the middle of this week then. All right, Frank.